Hello, future nurses. Welcome back to another power-packed NCLEX prep session. Every single day in this series, we're covering 2 to 3 high-yield topics, along with practice MCQs that sharpen both your knowledge and exam strategy. If you stay with us daily for the next 30 days, you'll be ready to pass the NCLEX on your very first attempt. Step by step, concept by concept, we'll make your foundation stronger and exam confidence unshakable. But before we dive into today's lesson, let me share something big. We've launched our complete NCLEX review crash course, already trusted by over 10,000 students who cleared NCLEX on their first try. Here's what you get when you enroll. Live daily classes with expert guidance, 500+ hours of recorded lectures for anytime revision, 100+ hours of animated crash lessons to simplify tough concepts, 5,000 NCLEX style and previously asked questions, 15 CAT mock tests in real NCLEX format, Next-Gen NCLEX question practice pack, detailed lectures plus PDF notes plus NCLEX ebook, and so much more, all in one place. Right now, you can grab this entire package at a massive 70% discount, but only for a very short time. Click the WhatsApp link in the description to claim your free 5-day trial and start your NCLEX journey today. And don't forget, you can also join our Telegram channel for extra free practice questions. Link is in the description too. Now, let's get into today's topic, the nursing process. If nursing is a science, then the nursing process is the formula that makes care safe, structured, and effective. It is the foundation of everything we do in nursing, and NCLEX absolutely loves to test it. By the end of this session, you'll not only understand each step, but you'll also know exactly how to apply it in exam scenarios and in real-life patient care. See the topic together. The nursing process has 5 key steps: assessment, diagnosis, planning, implementation, and evaluation, which we remember using the famous acronym ADPIE. Think of this as your nursing GPS. It tells you where you are, where you need to go, and how to get there safely. Step 1. Assessment. The very first step is assessment, and this is where everything begins. Nursing assessment is the systematic collection of data about the patient's health status. This includes subjective data, what the patient tells you, like, I feel dizzy, I have pain in my chest, or I cannot sleep at night. Objective data, what you observe or measure, such as blood pressure, heart rate, temperature, skin color, lab values, or imaging results. Here is a golden NCLEX rule. You always assess before you intervene, unless it is a life-threatening emergency. For example, if a patient says, I feel short of breath, your first action is not to immediately give oxygen. It is to quickly assess, check their airway, breathing, oxygen saturation, and lung sounds. Only after that do you decide what intervention is needed. Clinical example, a patient reports abdominal pain. Subjective data, my stomach hurts. Objective data, guarding, tenderness, elevated white blood cell count. Without proper assessment, you cannot differentiate between indigestion, appendicitis, or gallstones. Step 2. Nursing diagnosis. Once you have the data, the next step is nursing diagnosis. This is different from a medical diagnosis. Doctors diagnose diseases, but nurses diagnose patient responses to health conditions. Examples: medical diagnosis, pneumonia; nursing diagnosis, impaired gas exchange related to alveolar inflammation as evidenced by low oxygen saturation. This step is crucial because NCLEX wants to see if you can frame problems from a nursing perspective. Remember, nursing diagnoses use NANDA-approved terminology and focus on how illness impacts daily life, function, and safety. Exam. Tip. If an option on NCLEX gives you a medical diagnosis like heart failure as a nursing diagnosis, eliminate it. That is a trap. Step 3. Planning. Now that you have identified the patient's problem, you move to planning. This is where you set SMART goals: specific, measurable, achievable, relevant, and time-bound. Examples: wrong, patient will feel better soon. Correct, patient will maintain oxygen saturation above 94% within 2 hours of oxygen therapy. Planning also includes setting priorities. And this is where Maslow's hierarchy and the ABCS, airway, breathing, circulation, become life-saving tools. NCLEX. Trick. If you have a patient with both severe pain and difficulty breathing, your priority goal is related to breathing first. Pain management is important, but airway and oxygenation always come first. Step 4. Implementation. This is the action phase. In implementation, you put the plan into motion through interventions. Interventions can be independent nursing interventions, things you can do without a doctor's order, like turning the patient to prevent pressure ulcers, teaching relaxation techniques, or encouraging fluids. Dependent interventions, things that require a provider's order, like administering prescribed medications or inserting a urinary catheter. Collaborative interventions, things done in teamwork, such as working with a physical therapist for mobility exercises. Clinical example, if your patient has impaired skin integrity, interventions might include repositioning every 2 hours, keeping the skin dry, and applying protective dressings. Exam tip, NCLEX may ask, which intervention should the nurse do first? Always pick the one that directly addresses the priority diagnosis or prevents immediate harm. Step 5. Evaluation. Finally, we come to evaluation, the reflection point of the nursing process. Here, you ask, did my interventions achieve the goal? If yes, great, you can continue the plan. If not, you must reassess, adjust the diagnosis, or modify the interventions. Nursing care is cyclical, not linear. It never ends after one cycle. Example, if your goal was, patient will report pain less than 3 out of 10 within 1 hour of receiving analgesics, and the patient still reports pain of 7 out of 10, you must reevaluate. Was the dose too low? Was the drug ineffective? Or is there a complication like internal bleeding? Putting it all together. Clinical scenario. Let us apply ADPIE to a patient case. A post-operative patient says, I feel short of breath. You start with assessment. Check oxygen saturation, 88%. Observe rapid respirations. Auscultate crackles. You form the nursing diagnosis. Impaired gas exchange related to fluid accumulation as evidenced by hypoxemia and crackles. Next is planning, goal. Patient will maintain oxygen saturation greater than 94% within 30 minutes. Then implementation. Administer oxygen as prescribed. Position patient in semi-Fowlers. Encourage deep breathing. Finally, evaluation. After 30 minutes, oxygen saturation improves to 96% and the patient reports easier breathing. Goal met. This shows how nursing care flows logically from one step to the next, and NCLEX loves to test if you can see the sequence. NCLEX high-yield pearls. The gold standard for pain and symptom assessment is always the patient's self-report. Always assess before you intervene unless ABCs are compromised. Nursing diagnoses focus on responses, not medical conditions. Maslow's hierarchy and ABCs guide priority setting. Evaluation is not optional. It is the only way to know if care was effective. Memory trick. ADPIE equals a delicious pie. Just like you cannot bake a pie without following the recipe, you cannot provide nursing care without following the process. Before we continue, here's the fastest way to boost your NCLEX success. Our crash course has already helped over 5,000 students pass with confidence. You will get 100 hours of animated crash lessons, 500 hours of recorded lectures, daily live doubt clearing sessions, 5,000 authentic practice questions, 15 CAT format mock tests, and a focused NCLEX ebook, all with 1 full year of access. Right now, you can grab this at a 70% discount, but only for a limited time. Click the WhatsApp link below to claim your free 5-day trial and start preparing smarter today. Now, we will solve some questions. Let us start with the first question. A nurse enters the room of a patient who reports chest discomfort. What should the nurse do first? Option A, ask the patient to rate the pain on a scale of 0 to 10. Option B, obtain a full set of vital signs. Option C, administer prescribed nitroglycerin. Option D, document the patient's complaint in the chart. The correct answer is option B, obtain a full set of vital signs. This is part of the assessment step, which always comes first unless there is an immediate life-threatening situation. Option A is incorrect because although pain assessment is important, chest discomfort requires objective assessment first. Option C is wrong because nitroglycerin should not be given until vital signs confirm it is safe. Option D is incorrect because documentation follows care, not precedes it. The Stancoast pearl here is that with chest pain, you always think airway, breathing, circulation, and vital signs give you those answers. Moving on to the second question. Which of the following represents a correctly written nursing goal? Option A, patient will feel less anxious soon. Option B, patient will verbalize a decrease in anxiety from 8 out of 10 to 3 out of 10 within 2 hours. Option C, nurse will provide relaxation therapy twice daily. Option D, patient will continue to need medication for anxiety. The correct answer is option B because it is specific, measurable, and time-bound. A true SMART goal. Option A is vague and not measurable. Option C describes a nursing intervention, not a patient outcome. Option D assumes continued dependency rather than measurable progress. The Stancoast pearl is that goals are always about measurable patient outcomes, not what the nurse will do. Now for the third question. The nurse is caring for a post-operative patient who reports pain. Which step of the nursing process is the nurse performing when administering prescribed morphine? Option A, assessment. Option B, implementation. Option C, diagnosis. Option D, evaluation. The correct answer is option B, implementation, because administering medication is an action step. Option A would have been collecting data. Option C is identifying the problem. And option D comes afterward to check if the intervention worked. The Stancoast pearl is that implementation is the doing phase. Let us continue with the fourth question. A patient is admitted with pneumonia. Which nursing diagnosis is most appropriate? Option A, pneumonia. Option B, impaired gas exchange related to alveolar capillary membrane changes. Option C, bacterial infection of the lungs. Option D, antibiotic therapy, need. The correct answer is option B because nursing diagnoses describe the patient's response, not the disease. Option A and C are medical diagnoses, not nursing diagnoses. And option D describes treatment, not a patient problem. The Stancoast pearl reminds you, nurses diagnose human responses, not medical conditions. Next is question 5. During evaluation, the nurse notes that a patient's blood pressure remains high despite antihypertensive therapy. What should the nurse do next? Option A, document the findings and continue the current plan. Option B, notify the provider immediately without further action. Option C, reassess the patient and modify the care plan as needed. Option D, discontinue the antihypertensive therapy. The correct answer is option C because evaluation is about determining effectiveness and adjusting the plan accordingly. Option A ignores the problem, option B skips the nurse's role in reassessment, and option D is not within the nurse's authority. The Stancoast pearl is that evaluation always cycles back to reassessment and modification. Now, let us look at question 6. The nurse observes a patient grimacing during movement after surgery. What is the best initial action? Option A, administer prescribed analgesic. Option B, ask the patient to describe the pain. Option C, document the observation in the chart. Option D, notify the healthcare provider. The correct answer is option B because pain is subjective and the gold standard is always the patient's self-report. Option A is tempting, but you cannot intervene without assessing first. Option C delays care, and option D is not required before completing your nursing assessment. The Stancoast pearl. Assess first, unless airway, breathing, or circulation is compromised. Moving on to question 7. Which of the following is an example of an independent nursing intervention? Option A, administering prescribed insulin. Option B, repositioning a bedridden patient to prevent pressure ulcers. Option C, starting an intravenous line for hydration. Option D, ordering a diagnostic CT scan. The correct answer is option B because repositioning is a nursing action that does not require a provider's order. Option A and C require prescriptions, and option D is outside nursing scope. The Stancoast pearl is that independent means nurses can do it on their own authority to promote safety and comfort. Next, let us take question 8. A patient with diabetes has a goal of maintaining blood glucose between 80 and 120 milligrams per deciliter. Which finding during evaluation shows goal achievement? Option A, blood glucose level of 100 milligrams per deciliter. Option B, blood glucose level of 160 milligrams per deciliter. Option C, patient states, I feel less thirsty. Option D, patient requires increased insulin doses. The correct answer is option A because it is objective and within the target range. Option B is too high. Option C is subjective and unreliable. And option D suggests poor control. The Stancoast pearl is that evaluation relies on objective evidence, Now to question 9. The nurse collects data on a patient with heart failure. Which step of the nursing process is this? Option A, planning. Option B, diagnosis. Option C, assessment. Option D, implementation. The correct answer is option C, assessment. Gathering subjective and objective data always comes under assessment. Planning happens after, diagnosis analyzes data, and implementation involves action. The Stancoast. Pearl is simple. Assessment equals data collection. Finally, question 10. Which action by the nurse best reflects the evaluation step of the nursing process? Option A, checking if the patient's pain decreased after analgesic administration. Option B, administering a prescribed antibiotic. Option C, teaching a patient about insulin administration. Option D, taking the patient's temperature after admission. The correct answer is option A because evaluation determines if the goal was achieved. Administering antibiotics and teaching are part of implementation, while taking temperature is assessment. The Stancoast. Pearl is that evaluation always asks, did it work and what next? And with that, future nurses, we have completed 10 high-yield NCLEX-style questions on the nursing process. Notice how each question highlights a different phase of ADPIE, reinforcing the importance of assessment, diagnosis, planning, implementation, and evaluation. By practicing in this style, you are training your brain to think the NCLEX way while also preparing yourself for safe and effective clinical practice. Thank you and see you in next video.